name's Neil Ice and I'm Clinical Director for IPC, and welcome to this short video taking you through how to work in a Miami clinic using TPP SystmONE. If you haven't already, I'd suggest you get yourself a cup of tea, settle back and relax as we go through a few topics that are important about the differences between Miami clinics and the GP clinics you're used to working in. Launch SystmONE by clicking on the icon. If you're already logged into EMIS because you're working at a site with dual logins, you can just click on Log On with SmartCard. Otherwise, this is the point at which you should insert your SmartCard. It's important that you do know your manual login for SystmONE, because if you forget your SmartCard or there's a technical problem with the SmartCard, you will be needing to log in manually. If you've forgotten your password, you can reset your password if you log in successfully using your SmartCard, so it's worth doing that before it becomes a crisis. Log into IPC Clinical Practitioner Access Role and SystmONE will open up. Miami clinics are not just about working at scale, they're also about promoting the best possible benefits of general practice. One of those that we think is most important is about continuity of care, which we realise is difficult in a modern environment. Miami clinics can see simpler episodes of illness that are usually dealt with in a single consultation. By doing so, that frees up GP practices to provide more resources for those patients with complex needs or who need continuity of care. We also want to avoid pushing work back to general practices. We aren't doing a good job if we simply just send the patient back for another consultation with their own GP. We have also prioritised using local clinicians so that they're aware of local policies and protocols and can give the best possible and most efficient service for patients. The Miami criteria are closely defined. This is a deliberate policy to try and make sure that the sort of patients who are coming in for a Miami appointment won't need continuity of care, and many of their conditions will be dealt with in a single episode. We ask the receptionist to screen all patients that it's a new onset problem, that it's been there for less than about 4 weeks or so, that it isn't mental health or pregnancy related, and that they haven't seen a doctor about it before. If the patient doesn't meet these criteria, they shouldn't be filtered through to Miami. The reality is that some patients do get through, either because they aren't answering the questions correctly or because the receptionists aren't screening. It is important that you explain to patients where you can't really service their needs, and also that you feed back to the reception team at the practice so that they can improve their procedures and avoid sending patients who don't meet the criteria. As far as possible, you should try and deal with the patient's presenting problem, but acknowledge the limitations of the service that we offer. When a patient arrives at Miami, they will check in with the receptionist, who will obtain verbal consent to share their clinical records from their GP practice. They will also be given a written information sheet which contains more information about sharing their records, and patients are advised in this sheet that they should be talking about one problem only in the consultation, that it isn't for ongoing issues, and that we don't get involved in repeat prescriptions. Record sharing is fundamental to the way the Miami clinic operates. We rely on being able to see the patient's GP record to give them a seamless experience. Most patients actually think we already share their health records, and those who don't are usually happy to do so. Only a tiny proportion of patients actively opt out of record sharing when the benefits of it are explained to them, and our experiences in Miami are that only 0.03% of patients have actively opted out when they've come for a Miami consultation. Patients who don't want to share their records should be screened out before they come to Miami, but occasionally patients will come through who've previously opted out, usually after reading articles in newspapers or being worried about the care.data scheme a few years ago, and they will have closed off the option of sharing their records from their own GP practice. The TPP model of sharing medical records is quite complicated. The best way to think about it is that each organisation owns its own data, but also that there are gateways in and out that share information to the wider cloud of medical records for the patient. Each organisation has a responsibility to obtain consent from the patient relative to that organisation. So at the Miami clinic, the reception staff will gain consent for both in and out sharing of information from the Miami clinic. Other organisations, such as the GP practice, will also need to obtain consent to share information in and out. There are other organisations that also contribute to the health record, such as Child Health or the Hospice, The design of the in and out gateway for information is specific because it is intended that for certain specialised clinics, for example sexual health, a patient may want to have their GP and other health records shared in so that they're visible to the sexual health team, but not have the nature of their condition or treatments shared back out from the sexual health service. The problem comes when patients haven't opted in or have actively opted out of sharing information from their GP record. From the point of view of the Miami clinic, in this situation, we would be able to see all of the patient's records that are shared back into the cloud, so the child health, the hospice information, but we wouldn't be able to see the GP practice data, nor would we be able to see sexual health. This is absolutely the way that the system is intended to work, and patients can choose to share information from and to each organisation. The problem is that we at Miami have no control over the sharing consent at the GP practice, and if the GP practice haven't obtained consent and recorded it at the time that they book the patient into the Miami clinic, then we have no ability to access that information. The patient will need to go back to the GP practice to change the settings, and we give them a specific letter that explains to them how to do this. If a patient has opted out of sharing or hasn't actively opted in to share their record, then we cannot access their notes. This makes the consultation much more challenging, and we'll come to that in a moment. It is important that the patient is aware of this and that they're given a copy of the opt-out letter that we've created that tells them how to fix this problem with their own GP practice. So to reiterate, if the patient is not sharing out information from the GP practice, then at Miami we cannot see the GP record. It's worth noting we can often see other areas of health records, such as child health or hospice information, and that can give you the false impression that you have access to the full record. It's important that you look for the TPP Phoenix logo, which you can see alongside the patient information at the top of the record. If you can't see the TPP Phoenix logo, then you don't have access to the GP record, and you should treat the consultation with caution. We advise that you continue with your consultation despite lack of access to the records, but you do need to be very careful about the consultation. You may not be able to do as many things as you do normally, and it's important that you take an appropriate medical history, record allergies and current medications where appropriate. You should also ensure that the patient has been given a copy of the opt-out letter so that they can change their settings back at their GP practice. If patients don't want to share their record, they shouldn't attend the Miami clinics in the future. Once SystmONE has opened up, you can go to the appointment screen by clicking on the icon. If you're working at a Miami site that uses EMIS as the main diary and appointment booking system, we put TPP patients into a ghost list, and you'll see that the patients are marked in the appropriate ghost list for the location where you're working, and your receptionist will mark them as arrived, and you can open them and begin your consultation. If you're working at a Miami site where TPP SystmONE is running the appointment book, then you'll have an appointment list under your own name filled with your patients. Your receptionist will mark patients when they've arrived, and they will obtain verbal consent from the patient for sharing the Miami record in and out. When you're ready, you can view the consultation. Because this is a test patient, the TPP GP record sharing logo isn't showing up. So we've loaded a real patient record and anonymised the data, which you can see in this still image here, and you're looking for the TPP Phoenix to be present, which indicates that the record is being shared. If you can't see this, then you're not seeing the full record, although you may see some clinical information shared from other organisations. It's important for patients where you don't have full access to the record that you proceed cautiously and make sure you take a full history. Your responsibility as a clinician at Miami is slightly different to your normal role in general practice. As far as possible, try to complete an episode of care if you can. Make sure you safety net appropriately, directing the patient back to either their own GP practice or the NHS 111 system or the emergency department as appropriate. Try to avoid getting the patient to book a routine follow-up appointment with their GP unless it's necessary. We're trying to limit the impact on general practice and take work away from practices, not make extra work for them. Your entries into the clinical system are just notes. We don't ask that the practices read your notes, and they'll only come across them if they're reviewing the record for some reason. If you need the practice to do something or to be aware of something, then you'll need to send a task to the practice so that they can action it. don't assume that they will find comments in the notes and be able to act on those. We're trying to limit the impact on general practice and not asking them to read every consultation that we generate. You can do your consultation in SystmONE as you would normally do. When you're recording your consultation in the notes, please make sure you have at least one coded problem, symptom or diagnosis. This is really important so that we can audit and track the Miami activity and make sure it's appropriate. Make sure that your notes are clear enough so that somebody else can continue the patient's care if necessary. Don't assume that they will understand all your abbreviations. The settings in Miami SystmONE are different to what you're used to. Some of the toolbars and clinical trees will have been redesigned to be optimized for what we need in the Miami system. Remember, you aren't using your normal version of SystmONE. Some of the local processes and protocols that you're used to using won't be active, and also that you'll be looking at shared records. The quality of the problem recording and note-taking of other practices may not be as good as your own practice, and that may mean that you need to be extra careful and not make assumptions when making treatments and plans for patients. You should also be aware that patient expectations can be quite variable, particularly as the Miami clinics get going. Patients don't necessarily know what to expect. They may have been misinformed by their receptionist when they had their appointment booked. And also, they may be used to a different level of service at their own practice to the one that you're used to offering at your practice. Please be accommodating and respect the differences that may occur. If you need to issue a medication in SystmONE, click on the Acute button, which is on the top of the toolbar, and add the medicine that you'd like to issue. Click on Search and choose the preparation that you want to use. SystmONE doesn't often suggest the most helpful of patient instructions, and you may wish to type more specific instructions. When you've completed the medicine, click on OK. When you're ready to issue your prescriptions, click on the Quick Print button, which will send the prescriptions to the printer. Prescriptions in Miami are handled slightly differently. All prescriptions must be printed because at the moment EPS doesn't work for the community versions of the software that we use. You should make sure you know where your local late pharmacies are, and if you're not sure, please check with your administrator at the reception desk. You should make sure you prescribe following local and CCG guidelines. Don't add anything on as a repeat item. This causes lots of problems because repeat items can then only be cancelled or amended from within the Miami clinic and not from the home GP practice. If you do need to set something up that you think might turn into a repeat medicine, add it on as an acute and send a task back to the practice asking them to put it on as a repeat at their end. At Miami, we don't issue any repeat medications, and patients are told about this when they check in. The reasons for this are several. One is that we want to make sure that practices' own policies and systems for safe prescribing are followed, and at Miami we don't have each individual practice's own policies in place. Every practice has its own policy and systems for managing repeat medication requests, and it's important that patients engage with those and don't work around them in clinics such as Miami or the out-of-hours services. There are some exceptions where we should be issuing medicines that patients normally receive as repeat medicines. For example, giving out salbutamol inhalers for patients who are having exacerbations of asthma or COPD. The main aim is not to be issuing patients normal repeat medicines and to be directing them back into their practice's usual systems for requesting these. It's also important that Miami doesn't become seen as a backdoor for addictive drugs. Practices work hard to manage patients who have addiction problems. It isn't helpful if they can access medications that their own practice would prefer them not to be receiving. The nature of the Miami screening system, the fact that patients are supposed to be attending for problems that are new onset, that they haven't seen a doctor about before, and are not mental health related, should screen out most problems, but occasionally we do see people with problems sleeping or requesting strong analgesia. Our advice is that you shouldn't be prescribing sleeping tablets. If this is the first presentation with sleeping problems, the patient should be given advice and sleep management and hygiene strategies rather than tablets. We also advise that you shouldn't be in a position where you're needing to prescribe long-acting strong opiates. And wherever possible for pain, you should be avoiding giving out strong opiates of any sort or benzodiazepines except on the odd occasion that you might want to give them out for muscle spasm in something such as back pain. You should also restrict the amount of codeine and controlled drugs that you issue. You should use your clinical judgment when prescribing and try to avoid prescribing any of these medicines unless necessary, and be aware that we do audit prescribing to make sure that clinicians are following the Miami policy. Patients with symptoms or findings who meet the 2-week rule referral criteria need to be referred. If you need to generate a 2-week rule referral, you can access this through the dashboard up here, and this is also the place where you can find other forms such as non-obstetric ultrasound request forms and radiology forms. Click on the toolbar to open the dashboard and select the form that you'd like to use. You'll be asked to nominate the destination for the form. Very shortly, this section will automatically be filled in for you. Click on the Write Now button. Ignore any pop-up messages that come up. The form will open up for you and you can complete the relevant information that it asks for. Checkboxes can be made to work either by double-clicking on them and filling in the information that way, or you can use the form protection button to turn on and off the ability to fill in checkboxes. Fill in other relevant information, and your most recent consultations and other parts from the medical history will be attached at the back. Click Save and OK to clear that. It's important that you send a task to your administrator to tell them to send off the referral form. Pick the administration group for the site that you are working for. And I would suggest that you make sure that it's urgent by putting today's date on it and giving it a red flag. Click on OK and that message will go through. You should make sure that you give the patient a copy of the patient information leaflet explaining the process. You then need to complete the referral form, adding any necessary details. If you identify that they need any additional tests, such as the blood tests that are required as part of the workup for an endoscopy, then you should give the patient the relevant forms and ask them to organise this. Once you've completed the referral form, send a task to the Miami administrator for your site and they will send the form on to the 2-week rule coordinator. It's important to remember that it's the Miami administrator who is responsible for sending off referral forms and not your practice secretary. If a patient presents with problems that might need a referral but isn't part of a 2-week rule pathway, then the responsibility for actually generating that referral rests with their own GP practice. The reason for that is that different GP practices have a different range of skills, and they may also have referral management plans in place to reduce some referrals. We ask that you write clear enough notes that somebody could generate a referral if necessary based on your information. You should tell the patient that you will be contacting their GP practice and passing on the information, and that the practice will either make a referral for them or may contact them for further information or to start some treatment. You should then generate a task to the Miami team for the practice where the patient is registered, summarising the need for a referral, and the Miami team at the patient's own practice will then pass that to a clinician who will decide whether referral is needed or whether some other treatment strategy might be more appropriate. If you need to feed back to a practice, perhaps because the patient needs further action or perhaps because the patient didn't meet the Miami referral criteria, then you can send a patient task. Click on the task button, choose the organisation that the patient is registered with, and then choose user group and look within the list of user groups for the word Miami. You should see one or more Miami related groups, and this is what you should target because the team at the other end will be monitoring it and expecting Miami related queries. Send your message and click OK. Organising an X-ray or ultrasound is straightforward. The results will go back to the GP's own practice, and you should make sure that the patient is aware to follow up the results with their own GP. If you need to do plain film imaging, such as a chest X-ray or joint X-ray, then both paper or electronic request forms are available. You should complete it and follow the local protocols for organising the particular imaging test that you require. Either give the form to the patient if it's something simple and they can walk in for an X-ray, or send a task to the administrator who will send off the form to the radiology department and the patient will wait for an appointment. If you need to organise an ultrasound, if possible use the non-obstetric ultrasound, any qualified provider form which can be accessed from the dashboard on your toolbar in SystmONE. Please make sure that you choose and specify which organisation you would like to provide the ultrasound, and then send a task to the administrator who will send off the form on your behalf. If you need to do something that isn't covered by the non-obstetric ultrasound form, then you should generate a radiology request for Western Sussex hospitals and ask the administrator to send it off. It's worth being aware that usually the waiting time for this service is slower than it is using one of the alternative providers. Remind the patient that the results will go to their own GP practice and that they should follow up the results with them. Organising a blood test through Miami is slightly old-fashioned. Unfortunately, the computer systems used by the laboratory aren't compatible with SystmONE when we're running it for Miami. That means that you need to generate a paper form, and to do this you should generate a printed patient sticker. To do this, you need to know which sort of label printer you have connected to your computer. It will either be a Dymo or a Zebra. Click on the relevant button, and this will generate a patient label automatically for you, and it will pop out within a few seconds. You need to complete a pathology request form, filling in the relevant details, and give the patient the form and advise them to book the blood test either with their own GP practice or to use whatever the local walk-in facilities are in your area. The results will go back to the GP practice for follow-up. If you think that the blood test is extremely urgent, then it is possible that you should be considering referring the patient for admission. When you finish the consultation, make sure you safety net the patient appropriately. You'll see a pop-up questionnaire that just asks you about the outcome of the consultation. This is for audit and statistical purposes. This slide summarises the principles behind Miami's responsibilities with regard to follow-up, referral and investigations. The underlying principles are that we should provide immediately necessary treatment for patients, but beyond that, we should loop results and follow-up back to general practice to establish continuity of care. We don't aim to see any patient to follow up any tests or investigations in the Miami clinic. If you have a patient who's inappropriately booked into Miami, it's important that you close the feedback loop so that the reception team are more accurate in the future when booking patients in for Miami appointments. Please send a task to either the GP practice's Miami team or to your administrator highlighting the problem, and they will feed back to the receptionist and ultimately improve the quality of referrals into the Miami system. It isn't possible, given all the many situations that can present in general practice, to cover every eventuality. However, hopefully this has covered most situations. Processes and systems change all the time, and this video may not be absolutely up to date. We do keep a folder of up-to-date information and procedures for clinicians and administrators in folders at each Miami site, and if you have any doubts, it's worth consulting those. If you need any help, ask your administrator. You could also contact one of the other Miami sites for advice by telephone or using TPP instant messaging. The Worthing sites have clinicians who've been working on the Miami project for 2 or 3 years now and are experienced in most of the issues that might be puzzling you. You can also contact Alice Townsend, Project Manager for IPC, at alice.townsend1@nhs.net, or you can contact me, Clinical Director, at n.ison@nhs.net.